next few weeks to assess where we're at. Again, we want to be respectful of everyone in the K-12 system, including parents and students. We want to give them as much notice as possible. So it's an animal that we don't really know what we're up against. I think this is a start to buy us a little more time. And again, making sure that we can get as many people vaccinated as possible.
Thank you. For my follow-up question, I'm wondering if there's any new information on when rapid tests will be sent out to schools. I know that First Nations and schools in the north were supposed to be receiving them. Any word on when other schools will be?
Sure. I think as of today, I think we have, I think it's 17 school divisions have been sent rapid tests, plus northern communities, First Nations communities as well. So we do have some of the province covered. It's really a supply issue for us. So as supply rolls into Manitoba, we will be getting that out to the remaining school divisions around the province. My expectation is, and I hear there's some coming even this week, my expectation school divisions hopefully will be covered before they return to school.
From City News, Mike.
Hey, good afternoon. So there's time to assess more options. And sorry if this has already been asked, but can you let us know what other options are on the table past this 10-day or past the 10th?
Yeah, I mean, we've had to be pretty fluid throughout this whole pandemic. And, you know, we love to keep our students in school. That's been our goal. But we only have students in school if it's safe to do so. So that's why we rely on the guidance from public health to make sure that measures are in place so that students will be safe. Students and staff will be safe. So again, a new variant that we're dealing with. Clearly, it's spreading faster than other variants. We're not sure what it means to hospitalizations, what that will mean to ICU capacity. So all of those things will have to be evaluated. And that's why we rely on guidance from public health to that front. We have had to go to remote learning in the past. You know, that could be an option for us. We're not saying that is going to happen, but clearly that could be an option. But again, we'll take the next couple of weeks to evaluate the circumstances around Omicron and make decisions based on that knowledge.
Thank you for that answer. And my follow-up question, teachers are being asked to go back on the 6th and 7th to do professional learning and get prepared. What is the message to teachers? What should they be doing and what do they need to prepare for?
Well, hopefully we can give teachers a better understanding of where we're at closer to that time. And obviously we want to have as much information to people as soon as possible so that we know exactly what's going to happen on January 10th. But I think it's important that we do have our teachers in the classroom for those 2 days to be prepared for January 10th. So there will be no students in classrooms, but we're asking the teachers to attend and prepare for whatever January 10th will look like.
From CTV Winnipeg, Michelle.
It's Michelle it's Michelle from CTV. I'm just wondering, I asked this to Dr. Atwal earlier, but what are you hoping to learn from those extra days that we're getting from the 6th to the 10th?
Well, I think we're going to be learning a lot over the next couple of weeks. And as we gain knowledge about this Omicron virus and what effect it may have in terms of our healthcare capacity, our ICU capacity, how it's affecting people, how the vaccinations are effective against this new variant, I think it will give us some time to do that. I think even extending it a couple of days, the Thursday, Friday of that week, will buy us some time and provide a little more room for parents and students and those in the K-12 and the education side to prepare for whatever January 10th looks like. So we're really buying some time for that. Again, we want to get our rapid testing out to communities, out to students. We want to make sure we get as many people vaccinated as we can, and that's very critical. So I think buying ourselves some time is critical in this fight.
And I'm sorry if this has already been asked. I kind of jumped on a little late, but what changes could be made in 2 days that quickly?
Well, I think that the real thing is here, we need time to make sure that we get our tests out to students. We want to get as many students and parents and caregivers vaccinated as possible. Allows time to do that. It allows public health to do the assessments they need. And based on those assessments, then we can decide what January 10th looks like. I just think it's prudent to take those extra 2 days at the end of the week to make sure we're fully prepared and understand what this Omicron variant looks like.
From CHVN, Taylor.
Hi, good afternoon. I'm wondering what would trigger, after the holidays, schools going back online, either province-wide or on a case-by-case basis?
Well, those are the types of assessments that that public health will be doing over the next couple of weeks. Obviously, we'll be engaging with public health. We'll seek their guidance. I would say there's a lot of variables at play. This is a new variant, and we have to understand how this variant works, what the implications are to individuals, what the impact will be to healthcare in terms of ICU beds. Just a lot of variables there. So they will be looking at all of that, and in terms of the spread of the virus as well. So all of those factors will come into play. They will make an assessment based on that knowledge, and then we will respond to the advice that they provide to us.
Thanks. And what advice do you have for parents today? Should they be texting their kids to pack up their desks?
We will leave that advice to the local schools. Clearly, we've been down this road before, quite frankly. We've had to prepare for different avenues. And again, we're facing something new, a new variant. We have to make sure we understand this variant. We're going to allow ourselves at least 2 extra days before we come back to the classroom. So we're going to try to provide as much information as soon as possible to parents and students so they can be prepared for what we hope will be a safe return to school in January.
From the Winnipeg Free Press, Maggie.
Good afternoon, Minister. I'm wondering if childcare facilities for students under 12 are open. Is this not just going to be a step to close schools, but having those students gathered there? Why keep those open?
Yeah, I think the thought was to leave those open for students under 12. That's the direction that we have been provided from the folks over at Public Health. I think for the most part, those centers and the schools have been pretty good in terms of reducing transmission. So I think that's why Public Health has said we'll try to keep those centers open and allow access for those particular students. So I guess with any specific health related information, you could discuss that with Public Health.
Okay, and I'm looking to confirm, are school staff going to be required to be on site on those days when they come back, or is there an option for remote learning to limit those contacts?
At this point in time, we're asking school staff to attend those days. They will be instructional days, preparing for whatever January 10th will look like. We're asking students to remain at home, not attend school for those 2 days, but we are asking the staff to attend those 2 days.
From the Brandon Sun, Kyle.
Good afternoon, Minister. I've been reading a lot of from parents who say that they're just going to keep their kids at home out of concern for the Omicron variant. So what would you kind of say to these parents who believe that these couple days won't be enough to sufficiently keep their children safe from COVID in the new year.
Well, we're certainly respectful of decisions they may make to keep their students at home, and I think some of them will be making that decision on the unknown. And I think that's our point here. And public health is saying, listen, we've got a new variant that we don't know a lot about yet, and we need some time to figure out how this variant will impact Manitobans. That's why we're not going back to school for those 2 days. We'll have an assessment over the next 2 weeks. We will learn based on those assessments, and then we will have a medical and sound advice on how we move forward from here. So I think it's critical again. Uh, we as Manitobans do everything we can to get vaccinated. This will buy time for us to get vaccinated. It will buy us time to make sure that we get rapid tests into all the hands for those that want to use rapid tests, and just buy us more time to get prepared for hopefully a safe return to schools come January 10th.
Thank you. And what will be the primary means of communication throughout the holiday break if the province needs to communicate additional safety measures to parents and school staff?
Yeah, it would be similar to what we are doing now. I mean, public health officials are in front of the media on a regular basis. Certainly, education people will be available as well, including myself. We will be in close communication with our school boards as well, and they will be communicating directly with parents over that course of time. So it will continue much as you see today. We'll all be available through this. We certainly want to be mindful and be respectful of people's time. We appreciate changes will have to be made at the family level. So we want to give as much advance notice as we can prior to that January 10th date.
Thank you.
Thank you, Minister. We have time for a few more questions. Please proceed.
Minister, are you able to provide any kind of date? I know you mentioned you're hoping to give parents time when making the decision, but is 2 weeks out or 1 week into the break, how much time are you thinking here?
No, unfortunately, I can't give you a time around that. Obviously, there'll be a lot of conversations with public health as we go forward. They're the ones that are doing the work here to make the assessments, trying to determine just how this Omicron variant will impact Manitobans. We will continue to have discussions with them over the coming days. And again, as soon as we have concrete decisions, we will let Manitobans know.
Have schools or divisions or independent schools been given any guidance about the potential pivot to remote learning and how they should be preparing?
Well, we've been in this COVID battle for 19 months, and I would say schools have really responded very favorably. They have prepared for various outcomes. We've had various scenarios in front of us. I think they have been prepared for various scenarios. And this is just a warning. Be prepared. We're not sure what we're facing. We're just asking them to be prepared as well. And again, this is going to be based on assessments of what this new variant means for Manitobans. We do have tools. We do have tools available to us. And the number one tool is to go out and get vaccinated. And we're encouraging as many Manitobans to get vaccinated as soon as possible. So make your appointments, get to the walk-in clinics, get vaccinated as soon as possible. And that will be helpful in this fight against this variant as well.
Time for
Minister,
a couple more questions.
Given the Omicron variant seems to not care about someone's vaccination status if they only have 2 doses, are there any plans to distribute rapid testing kits to students in that 12 to 17 age group or even school staff?
Well, we have been providing rapid testing to school staff up till now. The intent would be to continue to do that. Again, we're optimistic we can get sizable supply from the federal government. I think that is certainly something we could look at. Again, we'll be seeking advice from our public health officials on that front. I think the message is clear, though, in terms of vaccination. If you do get vaccinated, you're not going to have as serious of an impact if you do, in fact, get COVID. And that is really our challenge, is to keep Manitobans out of the intensive care units. That is the real challenge for us. And that's why it's important that people make sure they get vaccinated so that they don't end up in the ICU, which is using capacity that other Manitobans do require.
Any last, oh, go ahead.
Is it too early to say whether the province is going to be able to continue providing those free rapid tests for staff who have chosen not to be vaccinated or who have not shown their proof of vaccination in the new year? Because I believe those tests that were provided back in October will soon be billed. They will all have been used by now.
Yeah, we're optimistic the federal government will continue to supply those rapid tests for us. And I'm not purview to the long-reaching discussions on that front, but certainly over the short term and into the new year, it looks like that supply will continue to come forward, and optimistic we can continue to provide those tests.
Last question.
Is there any chance the 10th could be moved later at all?
Well, that's a distinct possibility. I mean, obviously, we'd love to have our students in school if it's safe to do so. Again, the assessments will be done over the coming weeks, whether that's doable. And we will seek that advice from our partners over at Public Health, and we will be having discussions with school divisions as well. So too early to tell what January 10th will look like, but again, we're just asking school divisions to be mindful that keep all options on the table.
I believe CBC Sheila North has joined us. Sheila?
Hi there. Yeah, I was just wondering what threshold will you be looking for to make that call to extend the break even further?
Yeah, there's so many variables here that public health are looking at. So that's why we seek advice from public health on that front.
But you don't have any plans specific to what you're going to be looking for right now?
You know, again, we take direction from public health. I know public health are trying to assess what this new variant means to Manitobans in terms of severity, in terms of transmissibility, and what that will mean to the intensive care units that are in very scarce supply. So all of those are taken into account on this, and we'll look forward to their guidance as they make this assessment. We can then make decisions based on sound science.
Thank you, Minister. Thanks, everyone. This concludes our session.
Thanks, everyone. All the best. Have a Merry Christmas and all the best of the season. And I'm sure we'll be in touch before the new year. Thank you.